Dr. Vijaybhasker, Masters in Orthopedic. Today I will discuss about the various causes for the pain in the elbow joint. Elbow joint is hinge type of joint consisting of formation of a ulnar bone from the forearm and a humerus bone from the arm. These two joints with the radial head forms a hinge and rotational joint. So hence what I want to say is the elbow pain has many reasons to have a pain, that is a tennis elbow or flexor's elbow or arthritis in the joint or degenerative changes in the joints or any fracture in the elbow joint, possibility of bursitis around the joint, and there is a possibility of infection in the joint like it's a bacterial or chronic inflammatory disease like tuberculosis, and there is a tumorous conditions in the joint because of the benign tumor or a malignant tumor, and then there is a possibility of damage in the radial head fracture, and then there is a possibility of damage in the elbow joint. So these are the various elbow joint causes to rule out exactly why the pain is started in the elbow. So most common the people complain to us about a lateral epicondyle pain, that is the prominent part on the outer side of the elbow is called lateral epicondyle. Due to the epiphyseal injury in the epiphysis of the humerus in children cause the pain. Either it could be because of the epiphysitis or damage to the epiphysis or fracture to the epiphysis and displacement of the epiphysis fracture. And in adults most common we see the epicondylitis or inflammation of the epiphysis epicondyle because there is a damage to the attachment of the muscles which are related to the extensors of the forearm. So that ligament, that muscle is attached to the epicondyle cause the pain. That damage or the internal wound, non-healing of the internal wound at the epicondyle leads to the tennis elbow joint. Then the same way on the inner side, the medial epicondylitis also we see. Due to that also we the muscle attachment to the ligament, the flexor muscles which are attached to the medial epicondyle also causes the pain. And then there is a pain in the joint because of the bone. The degenerative changes also leads to the damage to the terminal ends of the bones which cause the pain. So these are the pains which commonly see in the elbow injuries or elbow degenerative changes or elbow soft tissue damage leads to certain common causes which to be treated doing an X-ray, if necessary CT scan and MRI, and then accordingly the medication, physiotherapy, splinting methods, or sometimes surgery is necessary to relieve the pain. So elbow injuries or elbow causes for the pain must be ruled out according to the diagnostic criteria, and do treat the elbow pain accordingly. It's a stage of pain and cause of pain.